Hi, everybody. It's nice to see everyone. My name's Kendra Lodewick, and I am a mom of three kids with type 1. So we've been at it for a long time and have a lot of years and site changes under our belt. And I'm really excited to introduce Rachael, our guest tonight. She is a pediatric endocrinologist or pediatric endocrinology fellow at OHSU. She was diagnosed with type 1 when she was 11. She was a competitive swimmer at that time and had how to navigate that condition within that context and how that might impact her future. And when she was younger, Diabetes Camp gave her the opportunity to meet other kids with type 1 and kind of create her own community. So she volunteered at Gales Creek Camp last summer, right? And will be volunteering again this. And we're really excited to hear her kind of tell us about her diabetes story and what led her to be an endocrinologist. And I think it'll be really interesting to talk to her about someone who has diabetes inside the endocrinology field. So looking forward to the conversation. I'll pass it along to you, Rachael, if you want to introduce yourself and tell us a little bit about yourself.
Absolutely. Thank you for that lovely introduction. I just want to start out with I feel honored and blessed that you guys invited me. I agree that having a diabetes community is a lot of what I owe my success and getting me through a lot of the hard times. And so I think having this platform is amazing. And I am thrilled to be able to be here today. So, as Kendra said, my name is Rachael Mullin. I am a first year Peds Endo Fellow at OHSU. So, how it works is I'm trained in pediatrics, board certified, but then we do 3 more years to specialize in endocrinology. So I'm in my first year, almost getting to my second. And a lot of kind of my decision to go into endocrinology was not just I got diagnosed and then next day I was like, I'm going to be an endocrinologist. There was a lot of moments that kind of happened, many of them at camp, which I didn't at the time realize how much that kind of set me up for wanting to find a career that really guided me towards helping other kids that struggled like myself. And so I'm hoping to kind of talk a little bit about that piece, but also point out that not everything was so linear. I struggled, I had hard times, and a lot of it was having the supportive family, friends, and this type of community that got me through it. So, as far as kind of my reason for pursuing endocrinology, a lot of it, again, has to do with wanting to work with kids who have type 1. And I think it's really important to normalize struggles, but to also celebrate victories, which is one of the things I think we really try and focus on at camp. And on my Peds Endo rotations, we get to work with medical students as well as residents. And one of the statistics that I love to share with them is that I think it was done by Stanford in 2017, where they say that people with type 1 diabetes make an extra 180 decisions a day. I would say that maybe that's accurate. Maybe we make more. I don't know. But I share this because I want these residents and these students to really know that diabetes is a day-to-day thing and to kind of put them in that perspective of, wow, there's a lot more than just, yeah, exactly. That's your favorite one. Yeah, Kendra. There's more than just kind of let's figure out the insulin dose, let's do that. But there's a lot going on in the background and also in the family kind of aspect. And so a lot of times when we have patients who have been newly diagnosed, I take a moment when I walk in the room to kind of see how the family is interacting and take a moment to tell them, look, this is tough, this is hard, and kind of give them that space before jumping right away. And I think a lot of that comes from my own diagnosis. I was 11. I've had it now for 22-ish years. And as Kendra pointed out, I was a competitive swimmer. And so figuring that out in that context was really tough because I, at the time, didn't know anyone else with type 1. And I saw it as a barrier. I really could not see life with type 1 diabetes. I thought I was going to wake up the next day and be told it wasn't a real thing. And I really, really struggled initially with, again, seeing how diabetes was going to fit into my life. And with going to camp, my mom had found out about it through, I think, one of her colleagues. She was a nurse, and she was like, we're going to go to this camp, and it's going to be great. And I was like, oh, no, no, no. I am not going to this camp. And it took a lot of kind of trying to convince me to go. It ended up being a family camp. And at the time, I was just like clinging to her the whole time, not really wanting to interact with anyone. And then one of the days she was like, sorry, we're having a parent session. You need to go off with the other kids and you're going to kind of do your thing. And at the time, I did not appreciate that. I was terrified. I didn't want to talk to anyone. And My mom, like we talk about it, my memory of how all these things kind of went down is so much different than how she remembers it. But my memory was I didn't want to be there. It was horrible. Her memory is you did great things. You gave your first injection at camp because you found this counselor, Danny, who you adored, and she showed you how to do it and you were able to get through it. And it's true. Like looking back, I do remember Danny. She went to Stanford. She had like a Stanford sweatshirt. That was like her thing. And she walked me through how to give my first shot. And it was really a huge deal. And it kind of, again, changed the course for me and let me kind of see like, wow, I could be like Danny and I could help these kids and kind of try and bring hope. That's one of the things I've always said in my med school essays and talking to people, but it's really true. I think the thing that I needed when I was diagnosed was just some hope. And when talking with my parents, they're like, the most important thing for us was seeing someone else who had gone through diabetes and was doing okay. And they're like, and so, and I tell them I have imposter syndrome a lot because I sometimes I'll try and connect with the adolescents, especially like the teenage boys, and like, we want nothing to do with you. You're not cool. But my hope always is that I can show people that if you want to be a doctor, you want to do whatever you can do it with diabetes. It just takes a little bit extra patience, planning, and advocacy. It's kind of been my road to becoming a Peds Endo fellow. And my kind of diagnosis, I think, at age 11, again, was actually in the context of swimming. So I was in a race. I like thought I was going to win. I was projected to be, in my mind, an Olympic swimmer. And it just got really tough towards the end. And they actually had to pull me out of the pool. And I remember making lots of excuses in my head and saying, okay, I don't know what's going on, but maybe I'm really tired. Things will get better. And ironically, we're actually going to Disneyland the next day. So I grew up in Northern California, and Disneyland, of course, is in Southern California. And so we drove. And every 30 minutes, I was peeing and chugging water. And despite my mom being a nurse and my dad actually having a brother with type 1 diabetes when they grew up, I don't think they really caught on to the symptoms. And I like to point this out because families, when they come into the hospital a lot, feel so guilty. They're like, I don't know how I didn't catch it. And I always tell them, no, you did the right thing. You noticed something was wrong and you brought your child in, and now we can give them the insulin and make them feel better. And so I like to point that out because even my mom's like, gosh, it happened and we didn't notice. And then there it was. And the reality is it's kind of an indolent process. And so we always commend our families that come in and tell them you did all the right things. And then the other message that we always say is it's absolutely not your fault. And we want the child to know it too. Oftentimes they don't look at me in the eyes when they first come in if they're frustrated, depending on kind of the age group, or maybe they're just not able to take it in. But I always say it, and I say it multiple times. This is absolutely not your fault. And I think that's a really important thing to hear because it's tough. I think a lot of kids, at least I felt when I went in and was like, what did I do wrong? Why did I get this? Why me? And I'll be honest, even as an adult, I still have those moments with my mom. It's like, even as a 20-something-year-old, I'd call her and be like, why? This stinks. Like, why me? And I think it's really important to normalize those feelings and to really give that power and know that having that support system and that community of people who can be like, yeah, this stinks, but this is how I got through it is really, really helpful. As far as kind of other things I wanted to highlight, I think, again, going through college, I went to UCLA with diabetes. My parents were pretty terrified when I was going. My dad was like, you're going to UC Davis because it's close. And I was like, nah, I'm going to go to UCLA. And when I went there, it was, again, a lot of just planning and advocating. And they were able to get me a room with a cool fridge where I was able to put my insulin and do all those things. But even then, I really, out of fear of being different, didn't want to request accommodations for tests. And really what that means is extra time if your blood sugar goes low. That's pretty much what it means. And finally, I was like, you know what, Rachel, just do it. And then you have that backing. And it doesn't mean that you're weak. It doesn't mean you're different. It just gives you that extra support. And sure enough, there was an exam I will never forget where I did go low, and having that extra time to be able to correct and then restart the exam got me through. And so one of the things that I always tell my patients and wish I could have told my younger self is even though it makes you feel different, it's okay. It's actually a lot of kids think it's really cool. A lot of people think it's really cool. They think you're really tough. And having that kind of resilience built in, I think makes for a really strong person, especially as they progress into adulthood. As far as other things that I wanted to kind of highlight, I think my approach, and I know Kendra was going to kind of ask me, like, what have I seen or wanted in an endocrinologist that maybe I didn't get as a kid, or what are the things that I want to focus on? I think it's really empowering the patient and the parents to know that you guys are the experts of your child's diabetes. Yes, we're the endocrinologist. Yes, we've done like the medical training piece, but you're there with them day in and day out. And so my first question always for parents who call me, even on the parent call, is, well, what are you noticing? What do you think? What kind of changes are you wanting to make? And of course, early on, a lot of times it can be kind of overwhelming. They're like, well, gosh, I don't know, but maybe he's running higher in the morning. I'm like, awesome. Okay, we'll start there. And so really kind of, I think what I would have taken too well as an adolescent is just feeling like I was a part of that team and empowered to kind of make those decisions with my physician, and kind of knowing that they valued what I had to say because it is my diabetes. And the other piece I always want to share, even with my kids that I meet in the hospital, is everybody's diabetes is different. Though I have diabetes, I don't know exactly how you're feeling, but there are things that we do have in common that we can talk about. But really, I think emphasizing that piece too, that everyone's story is different. Everybody's, life is different and we have it, but there's ways to manage it and work together and have this amazing community that we've created. And so that's why I think camp is amazing. And I would love going to Gales Creek. I'm excited to go again this year. But I really think it provides an opportunity for kids that may not be obvious in the moment, but then later on that they have this community of people and they get to just be a kid and they have other kids that have a similar thing that they share. And again, they get to see different technology, they get to learn other things. And though they may be resistant in the beginning, just like I was, it can have a really big impact on the future. And those are kind of some of the things I wanted to talk about initially. I am happy to answer any questions people might have or anything like that. And again, I am thrilled that you guys have asked me to come here, and I really appreciate you letting me share my thoughts and my story.
Thank you for that start. That was really great, Rachel. Super, super interesting path and story. I want to first pause and see if anyone has any initial questions they want to ask Rachel about either her experience or being an endocrinologist or endocrinology fellow or anything along those lines.
I had a question about sports.
Yeah.
You're a competitive swimmer. My son, he's almost 11 now. He runs cross country, and I'm such a wreck when he goes out on a race. And it's also like I know how important it is to make sure that his blood sugar is in a good range when he's going to go out and run, 3,000. I know if he's too high, that he's not going to feel well. And I'm also terrified he's going to go low. He's not gone for very long, like 14 minutes. So it's not a long time he's gone, but I know he could have a bad low in that time. Do you have any tips on like how we can help him when he's doing like a high endurance sport like that? And like how to make sure, like what would be like I don't know how he feels when he's at a certain blood sugar. So like what's like a good range for him to be at and a safe range, and and any tips on like what we should like feed him before. Like I don't want to like fill him up with food and then send him out to run. I'm such a wreck when he does his races. He's only done it 1 year. This fall will be his second year, but
That's awesome. I'm glad to hear he's doing all of that. And yeah, so I think, my perspective will be from kind of like the swimming, which is more, like you mentioned, kind of like an endurance kind of scenario. And so what I used to do on the deck of the pool would have Gatorade. And back then when I was diagnosed, I should add this piece too. I was so resistant to technology. We didn't have CGMs at that point. And actually it took me till medical school to even put a CGM on and wear a pump. So I will own that piece. But what I would do is I'd have my meter on the side of the pool and I would just sip Gatorade like intermittently throughout. And then I'll be honest, I was probably ranging in the 200s at times and then dropping. And it was probably this yo-yo. And I could feel it for sure. When racing, like before an event, ideally for me, and everyone's kind of feelings are different with how they perform with certain blood sugars. I always wanted my sugars to be in like the 150s to 180s. But like, as we know, diabetes does not always behave the way that we'd expect it. And so there were often many times that that was not the case. I think, our biggest fear is always going low. So generally what I would do too is I would get like higher protein snacks before, and then also give a little bit of that carb to kind of help with that quick kind of, if he's running and he's sprinting, that kind of piece can help too. But I think honestly, part of it's trial and error too. Working with him, seeing what works for him. Everybody's different, and just kind of finding his regimen and what works, and then using that kind of moving forward. But again, I totally understand how you feel. It's hard sometimes when your blood sugar's high. You feel, even when I'm studying sometimes, I was telling my mom, it was really funny. One time I was studying and my blood sugar was like 130, and I was like, wow, there's so much clarity. Whoa. And so, it's fair to always want it kind of in that tight range, but also knowing that this is diabetes and, he can totally function in the 200s and do those things. And you just got to find kind of the regimen that works for him. But again, I think it's great that he's doing all this sports.
Thank
That's
you.
awesome.
Yeah, I get so nervous. I like fill them with food, and I'm like, no, now
you're like, oh no,
300, and like, how can you with the blood sugar of 300? So.
I have the same like tendency because you want, and then it causes like, is your son on a pump at all, or is it he's doing injections, or what is his method?
He's on the Omnipod 5.
Yeah. Okay. So one of the things that we have found is like really similar to what Rachel said, but I too have that, like, you want to sort of like up ahead of time. And then especially up there on the pump, you realize like they're going to start pumping corrections into them. But we found, and I don't know if the Omnipod has this, but doing like a protein kind of complex carb snack, like an hour before he eats, and bolusing and like shaving off like 15 carbs without covering it. And then putting in, does the Omnipod have exercise mode or an exercise mode to it?
Yeah, it does have.
And you may have already found this, but we found starting that like much earlier than you would think helps a lot, because usually we used to have them start it when they would start the exercise, and it was like too delayed. They already had like enough insulin or too much insulin in them to kind of get that in the range of the exercise range you want. So we found like starting it like 2 hours ahead help them be in that like a slightly higher range, but made us less likely to kind of try to like really jack it up. And so that tended to keep them a little bit more stable throughout the exercise, just heading that or a little earlier on.
Okay. Yeah, thank you.
Yeah, I really like that you brought up the exercise mode, because that is a new thing that is definitely, I agree, very, very helpful. So when I go to the gym, when I remember, we'll put that on ahead, like an hour, like Kendra said, which is helpful in that regard too. But yes.
My son used it for PE. It actually helps. It helps a lot.
Yeah.
Yeah.
Pumps are
like
great.
Gives a buffer you don't have otherwise. Yeah.
Yeah, definitely.
Want them not to.
I was wondering, Rachel, when you're with the other like fellows, are there things you feel like you've already hit on some of them, like the, empowering the families and the patients, but are there other things you've noticed as you've gone through training that feel like, oh, I wish that they covered this more for endocrinologists, like that you, from your own experience, and maybe that like kind of empowering families is a key piece of it, but even the pieces you noticed with like how much it varies from one person to another, and how, you can do the same thing every day and the control can be different. If that is sort of like common knowledge among endocrinologists, or if it feels like, they have this formula and if you implement it, it will function. So I'm curious about that.
I will say OHSU was amazing, and the endocrinologists there are fantastic. And I feel like they really have taken on that. For example, blood sugars are data, and we take that data and then we give insulin, or, we give carbs, et cetera. And so I feel like the way that they structure their teaching for us as fellows is really trying to meet the patient where they're at. And again, that first message of this is no one's fault. Then day 2 is typically blood sugars are data. We use this to make changes. And really, again, I think trying to kind of partner with the patients. I feel like our educators are really fantastic too, as well. They do a lot of that, kind of meeting the families where they're at, really trying to kind of say, like, what does a day in the life look like for you? And let's make diabetes a part of that day. And so, okay, your child likes to do this at this time, then let's give a snack here. And so I would say, honestly, I feel like I'm training in a fantastic spot where they really kind of focus on all those pieces. I think when I was maybe diagnosed as a patient, I think a lot of it, and I think there's been a shift in how we kind of approach diabetes management just from reading and kind of experiences. But I think a lot more was emphasized on like the A1C. And this is a marker of how you're doing. And why was this blood sugar high on this random day on a Tuesday? I'm like, I don't know. And so I really feel like our team has done a really nice job of kind of not doing those types of things. But yeah, I think that there's been a shift, I think generally, which has been a very positive one. So yeah.
Yeah, I feel like that's definitely true. My mom also has type 1, and I can see the residual effect of having been diagnosed now. It's been for her 52 years, and she has a lot of shame around numbers, where it's like she feels really guilty that like she feels like she's doing something wrong. She has incredible control and no secondary complications. And when I say incredible control, I mean like she does a really good job of balancing herself, but balancing her life. Like she's not a super restrictive or regimented person, and she has had really positive impact, but she still has that kind of visceral when she is having a high blood sugar, or she's like the data feel like her report card versus information for her to make decisions based on. So I can only see that shift. And I can also see how it's easy to follow, even as a parent who was raised in the era of it being data. Still hard not to see something that's like quantitative, like not to feel like, that there's a causal effect, and there's not always a causal effect. And even if there was, that's not the issue. The issue, like, okay, well, now you have this result, and what do you want to do about it now? Because there are always going to be choices that you make that may lead you higher or lower than you might have ideally wanted, but that's also part of life. And so then what do you do with that? What's the next step to take? But I can see the attraction of used numbers as more or not action, but I can see that like that it would be easy to fall into that and not use them just as kind of data points, but
Absolutely.
more as indicative of, yeah.
I think even when I was diagnosed, the emphasis was on like avoiding highs. And so kind of what you're saying, like let's, complications, et cetera. But I feel again, like there's been a shift where now we really just want to prevent lows. We know that those are, dangerous. And so the idea being that we are living in a world now where we have fantastic technology that we really aren't seeing complications like we used to. And so that's another thing that we really try and emphasize. Because I think for me, the biggest fear I had, I share that my dad's brother had type 1, and back when he had it, they were using, where you peed on a stick to look at blood sugar and drawing up insulin in glass syringes. And unfortunately, he lost his eyesight because of it and had complications. And so I'll be honest, when I heard type 1, that was the scariest thing for me. And that's all I could think about. And I think for my dad, talking with him now that it's been, 22 years, he shared that. He's like, I was scared. I didn't know what this was going to look like for you. And so I think we're in such a good time now where we have so much support and access to things that we can kind of create a healthy, environment to support our patients with type 1 and people with type 1. So that's awesome though, Kendra, that your mom's done so great. I love hearing those stories. Even for me, that's inspirational for me to hear that.
And it was a real, it was like, so many things, so much of my story, like I did not realize what it really meant to manage diabetes until even though I grew up with a mother with type 1, I had no clue. But the benefit of it, I feel really lucky that I had a mom with type 1, because when our daughter, who was the first one was diagnosed, I was like, okay, like it was so much less of a shock. And we knew like we picked it up so early because we knew the signs to look for. And there were so many reasons why it was really helpful to have had that. And to see my mom, who had it at that point for 35 years, doing great and not at all like living the life she wants. And it was clear. We didn't have the same kind of shock value that I think a lot of families have. So I was really lucky for that.
Absolutely. I asked my mom before getting on here, I texted her, I said, can I share your story? And she said, yes. So my mom was diagnosed with stage 4 melanoma. And as part of her therapy, she got something called nivolumab, and it caused her to get type 1 diabetes, essentially. And so now we have the same pump and we have the same CGM. But exactly what she was saying is, despite kind of living that through, every day with me, she never fully understood it. And so now there's this kind of deeper connection of sorts because she's living it, and it's kind of more something that we can kind of connect on. And I'll be honest, it feels great knowing that she has it in many ways. Because when I'm like, do I have enough glucose tablets today? I'm like, oh, my mom's there. Or if I have it, she might have an extra Dexcom there. And so it's been a really it's nice in some ways to kind of have that
Yeah.
a little layer
Yeah.
of support now.
The team. Yeah. I mean,
The
it's like
team.
a team
Yeah.
effect. Yeah.
Absolutely.
Mhm. Any other questions?
I was I couldn't help, so you were diagnosed, what year was that? But
2001, I think.
2000,
They
okay,
told my
so
parents when it was tax day.
oh,
They
geez,
remember.
April 15th. That's funny. Uh, so that was so much has changed since
Oh yeah.
2001. I mean, what amazing amount of changes that have happened. And I have heard and seen one of our other pediatricians, Dr. Nicholson, sometimes shares a slide about the outcomes of the different treatments of type 1 over the years, right? So and even prior to the Dexcom and the auto pumps, the outcomes and the complications that people are seeing, even back in the mid 2000s, are not nearly as bad. Like, I mean, it's like 5% of people who have these really severe complications, where it used to be 50% or something like that.
Right.
So I guess my point is, like, you've lived a life where you're an expert in this now, where you've seen it done one way, where it's fairly simple and very, analog, right? You're pulling insulin, putting syringes, doing syringes and maybe pens. And then you transition to pumps that are very rudimentary. And then you transition to smart pumps, and then adding Dexcoms into that. That's really an awesome experience to come from when, you're diagnosing families and working with, new families. So I guess my question though is, what are you, my daughter was diagnosed before Dexcoms, and pumps were still, the little mini meds, and like it was just like very, very rudimentary. And now I see families diagnosed today, and even I get a little bit glued to my daughter's Dexcom, especially when, I don't know, I'm not as bad as I have been. I'm pretty, but I've met a lot of families who are pretty glued to these Dexcoms, and I feel, part of me feels like I'm a not knowing in between, blood sugar checks every 3 hours was kind of nice. Like, it was a little bit of a blessing, like, in a way, because now when I look back, I think, okay, so she's at 120, and then I check her 3 hours later and she's like at 80, and I'm like, oh, okay, that's cool. But now I know that in between time, she could have been at like 40 and 340 and back to 80, and I had no clue that, that the ride was going like crazy. So in a way, it was like kind of better. I don't know. I'm not saying it was better. It's not better, but you see what I'm getting at, right? I was still stressed, 100% stressed, especially overnight was the worst, like the worst, because you literally had to get up and go into the other room and poke a finger and check the thing and then go. Now you can wake up and look with one eye and be like, okay, cool. Anyway, so my point is, you have experienced this from like literally first person. What are your thoughts on this and guiding parents as they're adopting these technologies, knowing, that there's, it's good and bad? I mean, I'm sure you've thought a lot about this. Now I want to hear you talk.
Yeah, I love that. So I love that you brought up the technology thing, because there's something called an injectees. Have you guys ever heard of that before? Okay. When I was diagnosed, what it was is it basically was this little, I don't know, plastic thing that you put the needle in, and then you
Oh yeah,
pull the
I
button,
did know
and
that.
then you press the button, and then it did it for you. And that was like the coolest thing at the time. So technology wise, that was a big deal for me because I didn't want to actually put the needle in my skin. But to answer your question, I think that sometimes what I worry about is exactly what you said. Technology overload or information overload. We talk a lot about this in our clinics because we're so blessed to have so much information in our hands. Like you pointed out, my mom used to come in the middle of the night. She told me it was terrifying. She'd be like, I don't know what your blood sugar was, but I'd come poke your finger. I'd do it again. here and there. And she's like, I just never knew what to expect. It would have been really nice to have a CGM, to be able to follow. So I think that piece has really probably alleviated a lot of stress. And I tell families, when they're thinking about, diabetes, especially with the little ones who may not be able to report kind of their symptoms, they're like, oh, I can't wait to get that CGM. And I'm like, yeah, that's fair. But to answer your question, I do feel like in some ways it was more simple because you kind of just got that point in time and you were able to react to it. But at the same time, I think that having the Dexcom specifically has been the most amazing thing for me because I hated poking the fingers. And it has been nice to know, as I'm walking into an exam or as I'm walking into here, I know where I'm at in that. Am I going up, down, or kind of staying? And so that piece has been really helpful for me. But I think from the provider view, I see a lot of times that parents understandably are like, the blood sugar is doing this all day and I'm worried. And what do we do? And it's like information overload, which is tough. It's information we want, but then sometimes maybe we don't really want to see it because then now we're like, oh gosh, what do we do at that point? And maybe it would have just worked itself out, like Rob was saying. And so I do think that we're in a point where it's very helpful, but sometimes it can be overwhelming. And so if it's feeling overwhelming, talking with providers of ways to kind of take that information in. And again, kind of what we were talking about earlier, not attaching feelings to it or getting too worried. Because I do get a lot of calls actually about compression lows, I think is one of the ones that I get. I actually got one today. The mom was like, oh, she was 40, but then I checked her blood sugar. I'm like, yes, good job, good job. She's like, and then she was 80. And this is my second day using a CGM. And I'm like, yeah, it's probably compression low. And then also parents point out, well, they're not the same. They're really different. One is reading like 40 points different than the other. I'm like, yep, that is also true. So I think just knowing what we have, the limitations of what we have, the advantages of what we have, then kind of keeping that model has been my kind of spiel for families. But yeah, it's fun to kind of think about how it's evolved.
Yeah. I appreciate one quick thing. I appreciate what you just said because I was thinking about it from my point of view, like, and this is what's so important to have, just to have someone who can articulate, who's not my own kid, right? Because my own kid's like, I totally hear her, but you can hear someone else a little differently. It's funny.
Yeah.
But I was thinking about how I feel about it, but ultimately it's way better for her because like she's getting ready to go, like drive or go play tennis or go to take a test or whatever. And to be able to look at that before you're about to do something and be like, oh, maybe I should do this or that, like I think that's a really, for a moment there, I was like, oh, I'm such an idiot. I should definitely.
No, you're not. And actually, I like that you pointed out.
Point of view more often.
No, I like that you pointed that out because actually I just took my PEDS boards exam and the way that they have it in there, my CGM's usually on my phone. And so you can't use your phone because they don't want you to cheat. And so I had to use the old fashioned finger poker and I was freaked out. I was checking my blood sugar every like 30 minutes. And so then I realized how like reliant I am on the CGM. And I was probably being like really reactive to my blood sugar. Just like I would like see like 180 and then like 160. I'm like, oh, I'm gonna go low. So I'd like eat a tab. But it was interesting to me that I was like really kind of reacting that way. And so I think you just even brought it up even more that I think I'm spoiled. I think I'm used to like seeing where I'm at. And so not having it kind of made me panic a little bit. I don't know.
Wow.
I found that that it's funny, Rob, I can totally understand where you're coming from because once our two older kids are away at college now, and so they're halfway across the country, and we are like, I am much more anxious about their numbers than I am like I hardly ever check their little brothers who live in our house because I'm like, oh, he's here, we'll figure it out. But I'm like, we need to like employ a system if we see something happening. And and so we're like much more anxious about it. And they're in a like 3 hours ahead of us time zone, which is helpful. So like we got 3 hours of their night before we go to bed. But I found myself like, this is combinations, one, then going away, two, I got hearing aids for hearing loss. And it's like Bluetooth to my phone. And I like can't, it's like I'm getting all the time, like it's this, and with three of them, there are like all these messages that I'm getting. And then just recently, I'm like, I was on a work call. I'm like, I can't this interrupt me, so I put it on like do not disturb. And I was like, oh my God, this is like, there's all these like numbers are going up and down and I am not paying attention to it. And it was so great. And I thought, I think I need to switch. Like I need to be aware of the lows, but I don't need to hear every high that they have because they're going to be on it and they're going to take care of it. And I just need to like simplify, prioritize what it is that I'm alerting to, because otherwise you also get like alert overload too. I mean, they get alert. I'm sure every person with type 1, their pump goes off and they're like, shut up. They don't even listen to what it's saying anymore because it's just too much. So I think it also would make me maybe I think I just need to pare down on the alerts that I'm getting. And then the other thing I will add just on that note is our daughter is studying abroad right now, and we made the mistake of starting her on the G7, or I guess she started on like insert her first G7 once she got to Europe, and you can't do that. Like you can't download the G7 app unless you're in the United States. So we still have to work with her to go through to get like a VPN, and she'll be able to do it through a VPN, but it's like this complicated thing. And she's been over there for 3 weeks. And I can't believe it, but like we have no numbers for her and we have all survived. And I'm like, this is a really good lesson. Like she's responsible, she's on it. I'm sure she likes to have some backup, but that also was really instructive to me, that here I thought like we really are really relying on it, and we're relying on each other, and I'm dependent on it. And yet here we are and we're all making it. So that was interesting too, when you have all this data available, and then the absence of it, I felt like I would just be losing my mind all the time, not knowing, but it's been working out. Partially also because she's on like almost a totally different night and day schedule. So I'm like, she's usually she's sleeping when I can't, it works out that we're kind of like not sleeping at the same time. So I don't have to quite worry about that. So, but in any case, it's challenging.
Yeah. I like that you pointed out the alarm fatigue, because my poor co-fellow, we sit right next to each other, and my, pump will go off, like you do, it's like vibration, and she's like, are you okay? And I'm like, oh yeah, I'm good. She's like, it's gone off a few times. I'm like, yeah, because I need to charge it. But
Yeah.
it's like you get so used to it, but other people are just like, oh my gosh. I'm like, it's okay.
Right. Do you find, Rachel, that you are like a celebrity among the endocrinology fellows? Like, are there many other people with type 1? Like, I would imagine this is not uncommon for people with type 1, if they're going into medical practice, to go into endocrinology. Maybe not. I mean, you can go into whatever they want. But are you like, it must be like the live, the live patient in the room with them. And I'm wondering if they ask you a lot of like follow-up questions, or what is that really like? They learn about something and they want to like, test it out for real.
So I wouldn't say that I'm a celebrity, but I love that. That made me giggle. My approach, so it's interesting. When I applied to medical school and even fellowship, a lot of people were like, do you see your diabetes as a disadvantage? And I was like, what an interesting way to frame that. Because their takeaway was, are you going to put too much emotion into this? Are you going to kind of not see things the way they are? Are you going to take your own experiences and put that on the patient? Fair questions. And so actually, a lot of times my approach, to be honest, is to not disclose I have diabetes. Sometimes I like have my pump out and I don't realize it. And I'm like, they caught me. But the times that I do, and I actually just recently did this with an 11-year-old, is when I can tell that I think it will really be helpful, because I really have to kind of navigate how is it going to be helpful and not take away from the patient themselves versus me just kind of being like, I have diabetes, and all these things. And so I have to really kind of focus that piece. But there was an 11-year-old who just was diagnosed, and family was basically saying she doesn't know anyone with type 1. She doesn't want to be different, blah, blah, blah. And so I was just like, all right, hi. And then we kind of went into it. And I think it was helpful. But again, I think, I've had some people say, oh, we've heard that there's a fellow that has type 1. And, I have heard that. But I think a lot of it, again, is me just really trying to take the skills I have, but not lead with my diabetes, but rather have those skills and use that to try and make the experience a little bit better. But
I was wondering if if the fellows, like the other doctors or fellows, if they have like specific questions for you, if they look to you for just insight that you can provide that they don't have.
To be honest, I'm looking to them still because they know so much about endocrinology. I think sometimes they show a curiosity, but I think that they work at Gills Creek. They've had a lot of kind of nice experience too. So not necessarily, but again, I think they're always wanting to hear kind of how things are and are always worried about me and want to make sure that I'm doing okay.
Yeah.
But yeah.
Well, to your point, they're hopefully aware that everybody's type 1 is different. So they're looking to you and they're looking to the kids that they see at camp, and all of those are, data points from.
Absolutely. My dog is over here saying hi to me. I'm sorry.
I had a question, Rachel.
Yeah.
So when we have a great doctor at OHSU. She's very nice. I love our doctor. She's so great. One of the things that I've expressed is that I'm really concerned about the highs my son is having. I've talked about this at a lot of appointments because I know that the lows are more concerning, but I really care about the highs, and I also want to fix those as well. I feel like sometimes there's more concern about lows, and when I express like I'm trying to control the highs, I feel like I don't get as much of a response. Do you have like any suggestions? Like I don't want to just say like, oh, well, he's high sometimes. Like I really do want to fix it. And I'm not quite sure how to communicate that in a way to express like how important that is to me, while also fixing the lows. I mean, I do worry about the lows as well.
Yeah, I think it is, I think it is completely appropriate that you are worried about highs. And I think that that's fair. And I think, to be honest, depending on age, again, it goes back to kind of, I think, this shift where for younger patients, we often are so worried about lows that we allow kind of some of these highs because we know that that's just part of diabetes and it's not going to cause issues down the road. I think as far as communicating, I would do exactly how you just did it. Like it pulled my heartstrings when you were just talking about how, it's so distressing to you. I think you could say like, these are the patterns I'm seeing. So I'm seeing, that we're running kind of out of range in this part, and I don't think that he's feeling great. What are some ways that we can kind of think about, addressing this piece? I know that, as a team, the endocrinologists always want to kind of work with the families to kind of make these changes. But again, I think you pointing out like, hey, I'm noticing from this period of time that we're running high and, this is what we're doing. Do you think maybe making this change here would be helpful? I love when families do that because I'm like, yeah, actually, that might be a really good idea. Like, let's try it. Let's see. And, we have the ability to kind of make changes as needed if we need to give more or less. But I think, yeah, just kind of exactly how you just did, just expressing that, it's something that you just, maybe you think that he'll feel a little bit better if he's more in range, or this is just something that's been persistent and you're worried about it. I think I would probably just start from that perspective. But I do want to reassure you, I know that all of the team is always kind of wanting to partner with families and keep kids safe. And so I'm sure that they would be very receptive to your concerns for sure.
Yeah, sure. Yeah, our doctor and then the doctors are really great. But yeah, it's because I'm like left to try to fix these things on my own. And I don't want to have that relationship where I feel like I have to hide things from my doctor, or like
please don't ever. Yeah. No, you should tell them, be like, I'm worried. And then maybe they can explain to you, oh, this is why we're not, maybe this is why we're not making this change, because maybe there's some other thing that they're augmenting that maybe then will lead to changes there. So sometimes just being like, well, can you explain to me like why you're making that change? How will that impact that? I think that's fair too. Because again, you're the expert. You are with your child. You see how things are working. And so the endocrinologists are there just to kind of use their skill set to work with you to find what's best. So having you kind of say what you're noticing too, I think is really, really helpful for me too. Because sometimes it kind of cues me in. Like, I'm like, oh yeah, that is a trend right there.
Yeah. Okay. Kind of along those same lines. I don't know if anyone here has experience with the Omnipod 5. I was talking to a friend of ours whose son is also a type 1, and she was saying she's heard really good things about the t:slim and how it has tighter control. I don't know if anyone has any experience, or like, I know like pumps, it all just depends on the person. But yeah, I feel like maybe we don't have like great control with the Omnipod 5. We are having a lot of highs. I didn't know if that was like a thing. It's something that she heard, and I didn't know if anybody had any experience.
I don't know if I was present. I have the t:slim on. Part of it was because I don't know. This is what I chose. And I do feel like it's given me nice control. I think, again, like you said, each pump works for other people for other reasons. I don't know if I necessarily know that it has children have more highs. I think sometimes at camp I've noticed maybe sometimes T-Slim will have a little bit of a tighter control at times, but I don't know if Kendra or Rob have thoughts. I don't know if your guys' children have Omnipod.
Our kids are all on the T-Slim, so
Okay.
I don't have any experience with the Omnipod.
Yeah. I will say, I think we as providers sometimes have noticed that at camp specifically, that the kids on the control IQ, so the Dexcom talking with the pump, have had a little bit tighter control maybe when they wake up. But that's not always the case. So I think, I don't know if I can attest to whether or not.
Yeah, I know, and it just depends on the person too. Kendra, do your kids do okay with the tube? We got the Omnipod because I liked it. We've never been on a pump before the Omnipod, so it's I was our first. I was nervous about my son with the he's like very energetic. I'm just worried about him with a tube pump.
Yeah, our kids do fine with the tubing. Maeve was on the pump since she got it when did she go on the pump? When she was like 7. I think that like she was diagnosed, she was 5 when she was diagnosed, and she was diagnosed at a time when like you had to be fully on like multiple daily injections for like a year. They didn't want to put you on a pump any earlier so that you kind of knew the protocol. And then brother, the next, he was diagnosed at 8 and he went on a pump. We were living in Spain at the time, so he didn't go on a pump until we come back. So he was maybe like 9 when he went on it. And then our youngest was 4, was diagnosed, and he went immediately onto the pump. And so he's had a tubed pump since he was 4, and they all have been really active and very active in sports. And that is something that I think is very personal. Like, this is something that's interesting for your son as a cross-country runner. Like, my daughter, she wore her pump all the time, even when she's playing like intense soccer and whatever sport she's playing, or she's on the ultimate frisbee team in college, and she keeps her pump on all the time. And our son, the middle, is a basketball player, and he does not like to keep his pump on when he's playing basketball. So he has his off. It's harder for him. Like, control is harder. Like, he's not, every time he sits down, he doesn't give himself a little injection. So it's like, the intense exercise doesn't always exactly equal having your pump off for an hour. So it's like a dynamic that's a little bit more challenging. And then, just as an example, our 13-year-old, he is also really active, and he leaves his pump on he does like 4 different sports, and he leaves the tubed pump on for all of them and hasn't ever had a problem. So I think a lot of it's so kid dependent, but sometimes you can get a loaner pump just to try it, like just to see, so he could experience for like a week what a tubed pump feels like, and whether that's really restrictive for him or if he likes it. And that could be telling for him in terms of what he wanted to do next.
Cool. Yeah, thank you. Yeah, I was going to talk to our doctor about it, or the educator's next appointment.
Hi, I'm Cali. My son is 10. Can you hear me?
Yeah.
Okay. And he's on the Omnipod 5. And we were having problems with highs as well. And one of the things we did was adjust the target glucose and correction above setting. And then I adjusted it every hour per his schedule in school. And then I also went in and adjusted all the insulin and then the correction factor. And we got the highs down better. And we worked with our endocrinologist on that, and just kind of adjusted. He just had a shift in his semester. So I went in and had to make some adjustments around that again, but it's really helped, because I was getting frustrated because it doesn't seem to correct the highs as quickly.
Yeah, that's the problem we have. Once he goes high, he's high for hours. He just does down. But yeah, I might not have the settings refined enough. Yeah, I mean, trying to mess with the settings more. I do like that it catches the lows though. That is really nice. Like,
yes. Yeah.
At home, actually, I've just been putting in manual mode because it's just, I don't do it at school because I don't want him to go to low. But yeah, at home, I've just been having it in manual mode, and it actually works better. Like, I'm doing better in manual automated mode. But it's not really the point.
This wouldn't be the case for you or your son, I'm sure, but I have found among one of our children, and that the one thing is that, first of all, to Rachel's point, like those nighttime numbers to me are like the biggest gift of control IQ, or that have like when we first started, got their charts. I wanted to like frame everyone. All of those like just level lines were so beautiful to look at, and I was like, that is like living room worthy. But I do feel like there's a little bit of it can, depending on the personality and stage in life, I think it can maybe make you a little bit more complacent, like, because it does start to kick in. It just takes longer. Like you can be a little bit less precise, which I think is a gift. Like I think it's like anything you can do to make people with type 1 not have to be so precise is great, but it also I think can make, like, you can take advantage of that, I think, a little bit, which will make, even when the pump is giving corrections, if you're relying on it too much for those, as opposed to like entering your own information when you need to, it's just not, technology is just not there yet. So we have found with one of our kids that I think that sometimes happens, because it, like, you're relying on the pump because it's doing so much more for you now, and you're like, well, it'll catch me, it'll correct for me, and that can just lead to a lot more volatility than you might have had when you didn't have the IQ to rely on.
I think she's frozen.
Yep. Well, we will definitely have Dr. Cali back, Dr. Rachael Mullin Cali.
Yeah, I'm taking my video off.
There you are. If you'll come back, we'll definitely have you back, because
no, I would love to come back.
We barely touched upon some of the fun conversations that we've had just about different living life kind of stuff. So thank you so much for being here. It was super good, super fun. I'm looking forward to seeing you at camp this year, and just having another great summer. And also thanks everybody who made it to the end here. I know we had some internet issues lately, but anyway, thanks everybody.
Bye. Thank you.
Bye, Kendra.
So thanks everybody for coming.